Hello, this is a recording of the Nursing Skills Lecture on Safety based on Chapter 26 in the Fundamentals of Nursing, the Art and Science of Patient-Centered Care text. Slide 2 shows you the topics we will be covering for this lecture. So on slide 3, we're going to start talking about safety. Safety is defined in the textbook as freedom from danger, harm, or risk. As a nurse, your most basic underlying concern will be the safety of your patients, of yourself, and of other care providers. In 1999, there was an Institute of Medicine report titled "To Err is Human: Building a Safer Health System" that brought to public attention the state of patient safety. The report stated that up to 98,000 deaths a year occurred from preventable medication errors. Since then, there's been a lot of evidence-based research that has led to improvements in medication administration safety, in fall prevention, in communication among healthcare workers and their patients, and in infection control, among other areas. Promoting safety and preventing injuries are nursing responsibilities. The Quality and Safety Education for Nurses organization, QSIN, identifies safety as one of the competencies nursing students must develop before graduation. The nurse and patients need to work together to reduce risks in the home, community, and healthcare setting. Role modeling healthy behaviors increases your effectiveness as a teacher. Recently, Medicare has identified never events, which are healthcare-acquired complications for which Medicare will no longer reimburse institutions. These are serious and costly errors and are mostly preventable. They include injuries from falls, burns, and restraints. There are many factors that affect safety. Developmental considerations are listed here that are potential hazards at various age levels, and listed in page 699 to 700 in your textbook are teaching tips for each of these developmental stages. It is important for you to be familiar with these different suggestions to help parents and caregivers give better care at home and to maintain the safety of people throughout the developmental stages. There's also many lifestyle considerations and risk-taking behaviors that are indicated, such as smoking and alcohol abuse, drug abuse, as well as safety in the work environment, which as a nurse you will be wanting to assess and make sure people are aware of how to protect themselves in that environment as well. Interestingly, motor vehicle accidents are the #1 cause of unintentional death, followed by poisonings, falls, choking, fires, and drowning, according to the National Safety Council. On the next slide, we see some other factors that affect safety. There are environmental pollutants, such as air pollution, mold, asbestos, radon, carbon monoxide, lead, that can be found in hazardous neighborhood situations. There's also water contamination from industrial and agricultural waste, noise pollution that can cause hearing loss, stress, hypertension, loss of sleep, and soil contamination from pesticide use and improper waste disposal. A decrease in mobility or sensory perception can affect safety. When a person loses perception in hearing, vision, pain, or touch, they're more likely to have injuries and accidents, as well as altered communication ability. And that can be affected by fatigue, stress, medication, language barrier, disease processes. And psychosocial factors include depression, social isolation, reduced physical stamina, feelings of lost control, and helplessness. All of these factors you as a nurse will be assessing for in your patients. So the nursing process is the model that we will be using through the semester to develop nursing plans of care. And the first thing, as I just mentioned, was assessing. You want to assess the person, what's their developmental stage, what's their work environment. You want to assess what their living conditions are and what kind of personal risk factors they might be a consideration for their health. And then you want to make a diagnosis according to your assessments. You want to see if they're at risk for injuries, falls, poisoning, suffocation. Once you determine what their priority diagnoses will be, you want to develop an overall goal or outcome identification. And this is always based on the patient. It's patient-centered. So the patient will promote safety, or the patient will be preventing injury, remain free of injury. And the next part is implementing interventions. And that's the part that's based on what you should be doing. So the nurse will be teaching safety promotion. They'll be teaching ways to prevent injuries. We'll be teaching how to assess for abuse and neglect. So that's all the nursing interventions. And then finally, you're going to evaluate the success of your plan in the final step. If when you do the evaluation, you find that there's still a problem, then you have to go back and maybe come up with new interventions or come up with a new goal for your patient. But in some way, from the evaluation, you go back to the top and start with your assessments and your diagnosis, your goals, and your interventions once again. So on the next slide, we're going to be talking about falls. According to the CDC, the death rate from falls has increased over the past decade. In 2011, 22,900 older adults died from unintentional fall injuries. Men are 41% more likely to die from a fall, and women are twice as likely than a man to have a fracture. 95% of the hip fractures are from falls. So the falls are also the most common reason for hospital admission for adults age 65 years and older. Some other high-risk factors for falls are listed here. If the patient who's coming into the hospital has a history of falls, you're going to want to be closely observing that person. If they have an unsteady gait, a lot of medicines can cause a higher likeliness of falls, such as diuretics, tranquilizers, sedatives, and pain medications. If a person has decreased vision or a slower reaction time, some confusion or weakness, they are more likely to have a fall, as well as just being in an unfamiliar environment. So there are certain ways to reduce falls among the elderly. One is to encourage regular exercise that will increase strength and balance, such as Tai Chi or yoga. Another one is to review the medications. Encourage annual vision checks and make home modifications for safety, such as grab bars, railings on stairs, and making sure rugs aren't loose, so decreasing trip hazards and improving the lighting. On this next slide, you see different interventions you can make to prevent falls in healthcare facilities. You can complete a risk assessment. This should be done on every patient. And as you see in this box here, it's one of the national patient safety goals to reduce the chance of harm from falls. And they give you an example of one of the fall risk tools, which is the Morse Falls Risk Assessment. And it should be done once per shift, anytime there's a change in the status of the patient, and anytime the patient and the family should be educated on the fall reduction program and strategies to prevent falls. Some of these include keeping the bed in low position and the wheels locked, eliminating clutter in the environment, leaving on a night light, making sure the call bell is in reach, providing non-skid footwear, and hourly rounding with a purpose. Now what that means is when you're doing your rounding, either you or your nurse's aide or your tech, whoever's doing the rounding, they don't just look and make sure the person's in bed and not injured at the moment. They check for what we call at my facility the 4 Ps. You want to make sure the person doesn't not have pain, doesn't need to go to the potty or go use the bathroom, that their possessions that they might need, their tissues, their book, their whatever it is that they want to reach is within reach, and that they don't need repositioning. So some factors that contribute to falls are slippery floors, a lack of grab bars, toilet seats that are too low, beds that are too high. The CMS, Medicaid and Medicare, views falls as never events because they are preventable and should never occur. The Joint Commission requires that all hospitals have a fall prevention program in place. And if you ever, with a patient or a client, never leave them alone in the bathroom if they're at all unsteady or confused. And just make sure you're leaving your residents or your patients in the nursing homes in a safe situation at all times.